Hey, everybody. Welcome back to the Energy MD podcast, where we help people with chronic fatigue, ME/CFS, long COVID, and MCAS find and fix their real root causes, which are a combination of heavy metals, chemicals, molds, infections, and trauma. So, really excited today because today we're going to be talking with my friend, Dr. Eric Gordon, and he is also a chronic fatigue and ME/CFS specialist. And so, I'm really going to be picking his brain and getting to learn about his experience. And so let's learn a little bit about him. So Dr. Eric Gordon is the clinical director of Gordon Medical Associates, specializing in complex chronic illness. In addition to clinical practice of over 40 years, oh my God, Dr. Gordon is engaged in clinical research and is the president of Gordon Medical Research Center. He is focused on bringing together leading international medical researchers and cutting-edge clinicians focused on ME/CFS, Lyme disease, and autoimmune diseases. Dr. Eric, thanks so much for joining me today.
Thank you, Evan. It's a pleasure. Really is. It's been great. I'll call you Dr. Hirsch, but you can call me Eric. Evan, it's good. Flows. I met you interviewing you, and I really was impressed with your program and how well you've, set up the stages for what I think people need to do to begin as we say, the healing journey, get back to life as normal.
Indeed, yeah. And so I'm super excited about getting your opinion on chronic fatigue and ME/CFS. I know that you've got a lot of experience, a lot of years in the field. Um, and so let's kind of start when somebody walks into your office and they are chronically tired. Where do you begin?
Well, as I was gonna, as I had the experience this morning, is that when people have just chronic fatigue, in the last, I'd say probably 10 years, I rarely see those people. Though I did see one this morning, interestingly, because generally people don't come to see me until they've gone through a lot of the process. A lot of they've gone through the steps that I think you outlined so well, is looking for the toxins, looking for the lifestyle issues, balancing their hormones, making sure their guts are working, their nutrition is adequate. I mean, what I call the basic, but crucial, necessary steps. If you don't do those, once you get chronic fatigue, you're not going to get better. I mean, it's until you get chronic fatigue, you can, play all night and eat junk food and, do lots of things. And, maybe you're going to get other chronic illnesses a little bit easier and earlier in your life. Probably some achy joints and maybe some cardiac diseases. But a lot of people, their energy stays pretty good despite what looks to me like a horrific lifestyle,
Mm-hmm.
So something changes that allows the development of chronic fatigue. And so that being said, when somebody walks in with fatigue, especially, like I said, I think we should specify, because in my definition, chronic fatigue, I have the simplest way of looking at it. If you have post-exertional malaise, or if you overdo and feel bad the next day, then you're kind of fit my definition of chronic fatigue. Obviously, you need a few other things, but that's the big difference. Fatigue, you're tired all the time, but if you push yourself, you're a little more tired, but you wake up the next day and you're still the same as you were before. Okay, that's regular fatigue that can be leading to chronic fatigue. It can be the first steps, but those people generally respond well to often just hormonal tightening up. Many, once you get rid of teach them to stop burning the candle from both ends, and a little lifestyle changes. I think people with general fatigue, often it's just, they've through usually some toxins or toxic exposures, mercury is a big one. Their thyroid and adrenal axis is off, and, you balance that out. And often they're just the fatigue people will get better. Sometimes their reverse T3 can be elevated, and that needs to be addressed. But these are the people who I first started seeing. When I was first into medicine, I always saw these people, and they would they're the ones who inspired me to really go into this field, because when in conventional medicine we couldn't do much for them. About as much as I could do was adjust their thyroid a little bit. And then when I started to really launch out into treating these people, I went deeper into thyroid. Of course, initially, I think a lot of us do, and that's often the gateway drug for doctors treating complex illnesses, is often beginning to treat people with hormones. And you start to see, oh, it's really cool. But then I started to find people that didn't respond. And usually, there was a lot of GI stuff with those people, and again, the gut is often the reason that the thyroid is messed up, because so many people have, gluten sensitivities or true celiac, and you wind up with, thyroid, you can wind up with thyroid antibodies. So I'm circling here. So these are like considered like the ground issues. So like these are the things that we always want to be sure. And it's a lot what you write about is, the hormones, the gut. And I shouldn't say the gut like it's simple. I think the gut probably is the hardest thing to deal with in medicine. I mean, when people are really sick, it's easy to say, oh, the gut, we're going to deal with it. But it's we'll talk more about that later. That's a real minefield. But luckily, simple things do work for a lot of people. And then, once you get past the hormones, the regular toxins, and the GI stuff, you start looking at infections. And that's when you start seeing the people who I think fall more into the chronic fatigue world, where, and I said, my big demarcator between just fatigue and chronic fatigue is that, not only do you wake up in the morning with unrefreshing sleep, because lots of people with fatigue, if it's going on long enough, can wake up feeling tired still, and sort of they're that place they have to sleep more on the weekend, but they can push themselves during the week still. And then somewhere along the line, it slips over to, uh-oh, um, when I push myself during the week, I feel terrible the next day. And now you're slipping into the chronic fatigue world, that post-exertional malaise, that place where your body is not recuperating. And again, we don't have a complete answer for what really causes chronic fatigue. And I think it's very different in different people. And I think that's why the world of chronic fatigue research has been so frustrating, is because they're looking for a cause.
Right.
And do you mind if I'm sorry, let me know just if I'm rambling on too long, or I'm zigging where, but I am gonna zig and zag a little bit right here, because I was, one of the things that frustrates me in the research world surrounding chronic fatigue is they come up with many good ideas of what may be the potential cause of chronic fatigue. Okay. And if those of you who ever follow, what is it? Health Rising. It's a blog that's very nice. A lot of information on the research around chronic fatigue. I think it's a nice place for people for resource. But everybody presents their idea as the cause of chronic fatigue. And the cause of chronic fatigue is your mitochondria have stopped producing energy, but they're not broken. They've just they're responding to the environmental cues. They've done this as a way to protect you. Okay, and I'll say more about that near the end. We'll talk more about my favorite subject called the cell danger response near the end. And it's my favorite subject because it helps us understand. It's a story to put this illness into context. And that's why I'm saying I'm so frustrated with the research, is because people have great ideas. Yes, there's a problem with your renin and tryptophan metabolism, and yes, your immune cells are using too much energy. And right now I can't think, but there's like 10 other different really strong reasons for people to have chronic fatigue, but they only apply to some people and they're only part of the problem. Most people have a little bit of all of them. But if the researcher's focus is that this is the cause, and you try to fix that cause, and you give it to 100 people with chronic fatigue, and you only help like 10 or 15 of them,
Right.
in medical science, unfortunately, they take that as a failure because they don't understand the disease.
Right.
That was one part of the whole problem. So maybe let's make a bigger picture and include that as one piece along with these 6 others, and let's fix all of them kind of simultaneously. Maybe we might get somewhere. But also in chronic fatigue, if I have a 10% response rate to a therapy, that's cool. Okay, because that means I just have to find the people who respond, and I'm going to do well with that subset. But if I insist that everyone who comes to see me gets that thing, and then if they don't get that, I send them away because I'm done, then that's not so good. And in medicine, if you only get a 10% response, it's considered a placebo response, and people throw it away. Even if you get 30%, sometimes they go, who cares, but we care. And the other thing is that I find that people with chronic fatigue in my population, they're folks who've been sick for often, sometimes decades. They are not placebo responders. They have spent literally hundreds of thousands of dollars, and sometimes even millions, trying to get better. Okay, so when they respond to something, that's not a placebo, because they've had lots of people who've told them this will fix you,
Right.
this will give you health, and it hasn't. And so I really feel that's one of the big problems. It's not that people don't respect how hard people with chronic fatigue and all these other chronic illnesses work at getting well, and the disrespect for thinking that they're not working hard enough. But so I've rambled on here. So refocus me, and where shall we go?
Yeah, so I mean, it sounds like, and I agree with this, that we really need a different model for research, when it comes to this. Oftentimes I talk about how there's 38 different causes of chronic fatigue, and everybody has a combination of about 20, where the most important ones that I believe are heavy metals, chemicals, molds, infections, and trauma. What do you think of that statement?
I I I agree with you. I mean, and it's also, and what's hard is that everybody wants it to be one of those things,
Right.
and just here's a nice scientific thing. Dr. Navio, when he did, I said my claim to fame is that I supplied Dr. Navio with patients for his study. I often am referred to as a co-author, but I always remind people I supplied the patients, he supplied the brains. But but I do. I mean, I have inordinate respect for his intellect and for his ability to see pattern. Okay, because
Mm,
he comes from an evolutionary biology perspective, and that just lets you see more than what's in front of your face. But so that being said, when he's looked at about 8 or 10 chronic illnesses, including them chronic fatigue, using metabolomics, which means looking at about 500 to 800 different chemicals that your body uses to produce energy and to communicate with itself. These are not the hormones so much, but these are smaller chemicals, but they're crucial to what your body does. And what he's found is generally about somewhere between 40 and 50 of these 500 will be abnormal in the group of people with X disease, let's say chronic fatigue. With that, we found about 40 chemicals that were clearly different from normal. But out of that 40, only about 12 or so were specific to the chronic fatigue people. The other, 28 or 30 were individual. So basically, the people shared only 25% of the abnormal chemicals defining the illness, but because the other 75% of the abnormal chemicals were their own personalized biochemistry, your own weirdness. Like I say, we're all neurotic in our own ways, and your body is also. That's what makes it difficult when we're trying to unpack people who are determined to, I shouldn't say determined, people who are chronically ill. Okay, because when you're acutely ill, your body reacts like everybody else's. Okay. You're dealing with the acute event. And most of the time, because it happens every day, you don't even get sick, but you get exposed to a bug, your body just knocks it out. It's ABC. You don't even notice it. You cut yourself, it heals. You sprain, a mild sprain, it's annoying. And then a few weeks later, you forgot that you did it. Okay. That's when the body heals. It's all great, all cool, works all the time. And that's why life works for most of us. Chronic illness is when that system fails, when there are steps in that system, in that healing, that healing phase. There are distinct steps that Dr. Navio has labeled CDR 1, 2, and 3, calls it cell danger response 1, 2, and 3, but it just 3 steps, doesn't really matter their names even. And that first step is this inflammatory step where your body goes in and cleans up the damage. Okay. Or if it's a virus, it restricts the virus from getting enough nutrients. And that's kind of why you make a little less energy and you feel tired, but you're also restricting the virus from getting nutrients. And you have a lot of inflammatory cells, and they produce chemicals that make you feel tired and sick. And a lot of people with chronic fatigue get stuck in that first step of that cell danger response, where they get kind of better, and then they get a little stressed, and their body fights again really hard and produces these chemicals that make you tired. Because what happens when you get sick? We call it sickness behavior. You lose your appetite often. You don't want people around you. You want to lie down. Noise and light, everything is annoying. That's sickness behavior. That's just what happens. But it's supposed to be transient. It's supposed to last 1, 2, 3 days, slowly get better, and maybe after 5 or 7 days, you're supposed to be back to normal because your body has gone through this healing cycle. Chronic illness is when that healing cycle is interrupted, and enough cells, not your whole body, thank God, because you'd probably die if it was all stuck there, but certain percentages of your body, of organs in your body, get stuck in this healing cycle. And on the gross level, if you're stuck in this, what he calls the second phase, and the second phase is the healing phase. That's when your body is making new tissue. You've damaged things. Now you're repairing, you're making new tissue. But during that time, those cells are not communicating really well with other cells around them. Okay, because they're busy kind of growing up and learning how to function. And so the cell communication isn't good. So that organ, if you've got like a lot of those cells in the CDR2 in that second phase of healing in your liver, well, your ability to detox might go down. So, or if it's, depend on the organ, it's going to decrease your functioning a little bit. And if you're in CDR3, that third phase, well, during that third phase is when the cell is reintegrating. Okay, its cell receptors, its hormone receptors, its cytokine receptors are coming to fruition, are going back to normal. But during that phase, if you have a lot of cells that are stuck there, then you can start having, places where your hormones start looking normal in the bloodstream, but your body's not responding to them, which makes endocrinologists crazy because they just look at the bloodstream and they go, oh, your TSH is normal, therefore you're fine, and no, your TSH might be fine, but maybe your cells, because the cells that are determining how much TSH you make are in your brain, in your hypothalamus and pituitary. And if the cells in your kidney and liver are not responding appropriately, pituitary might not care. Okay, but the endocrinologists, like things black and white. So now I've confused it. So that's the story of a difference between acute and chronic illness. Is acute illness, your body goes through this thing called healing, which is really a bit of magic because medicine has a very limited understanding of what healing is. What the steps are in this black box, so to speak. Dr. Navio has broken it down to 3 stages, but the $1 million question is we don't really know yet how to get the body to move from stage 1 to stage 2 to stage 3. Okay. It seems to be when a certain level of chemicals are released and certain signals come from the brain, the system just moves on to the next step, and that's, but very few people are looking at that because everybody's looking for the single chemical that's going to
Uh-huh.
fix the problem. And it's this milieu, this change in the overall soup that gets the body to move to the next step. It's like a quantum leap. I don't know if you remember your high school chemistry, like when probably confuse people, but anyway, when the electron is in one valence, in one orbit, it takes a certain amount of energy to get it to bounce to the next, but it's got to be the right amount. A little more, a little less, it doesn't go. So it's kind of the same thing when it takes the right neighborhood, and the right combination of ingredients for the cell to move to the next step. And that's comes into how people heal, because one level, and I think, and you do it almost unconsciously, one level, you're taking away the irritants, the triggers or the root causes, whatever language people want to use for, the toxins, the bugs that maybe shouldn't be there, or maybe we just have to learn to live with a little bit better, the emotional stresses that need to be ameliorated a bit. When you take those away, that's good. But still, when people have been chronically ill, they often need a stronger signal coming from the brain, from the controller of all things. Because I know people, it's not that the thinking brain isn't what's controlling, but your who knows at which levels, but parts of the brain that usually we don't control very well are controlling everything. And if you ever wonder, when you go to sleep at night, within seconds, every cell in your body decreases energy production. So that's why the brain does control things in a big way. I mean, it's the whole body just shifts because this something up here shifts, but again, it's feedback. It's never one or the other.
Yeah, so then how do we make that change? So if this process of CDR 1, 2, and 3 is part of that healing process and it gets hung up at these different stages, if the healing is not complete, how do we foster a more complete process?
A combination of pickup sticks and pin the tail on the donkey.
I like it.
Okay. Because what we have to do is we have to look at the systems and see which systems are, when I say systems, which compensations. Okay, and let me just define myself better here. Is that when inflammation becomes chronic, then the body compensates to keep functioning. So it learns to, and I think the simplest thing is like if you sprain your ankle and you got to keep walking, you start walking a little funny, but you often can keep walking. You just have to, you can't put the weight, you can't move the ankle the normal way. You got to find a way of putting pressure on the heel that doesn't bother your ankle too much, So you compensate. And if you do that for a few hours, not a big deal. You do that for a few weeks, and even after that heals, you still might not walk so well because your body's learned a new pattern, a compensation, a new pattern. And so that's what we get into when we stay stuck in one or all three of those places, again, in different parts of our tissue. Our body compensates to do its best to live with the changes, but those compensations are often what produces the symptoms.
So can I redirect you a little bit here?
Yeah.
Okay, so then I'd like to talk a little bit about the gut. So oftentimes when people come to see me, they've spent 1, 5, 10 years trying to quote unquote heal their gut. And I tell them, you can't heal your gut if you have heavy metals, chemicals, molds, and infections that are inhibiting your ability to do so. Do you agree with that statement? If not, tell me why.
Yeah, well, for the same reason, because it's all a circle. Okay, it's all a circle. And that's what I meant when I said, like we have to play pin the tail on the donkey and pick up sticks. You got to find the place in the system that is susceptible to change, that is willing to yeah, it's the old story. The light bulb's got to want to change. Old joke. I'm sorry, old psychiatry joke. But but if the system has to be amenable to change, and sometimes there are places that just aren't going to move until they feel safe. So you have to find what's making that feel unsafe. So if the metals are causing a lot of inflammation, okay, and that's really getting your mast cells riled up, you know and then you got to see, you might be able to work on the metals, okay, but you might find when you move the metals, if I mean in people usually you can get away with moving metals slowly and gently, but slowly and gently, because if your glutathione is in the toilet and you try to move a lot of the metals, you're going to flare people. So that's the pickup sticks part. You got to make sure that the pieces are there to move. But yes, is that if you're toxic, your gut's not going to heal because you have low level inflammation going all the time, and you're going to change the milieu of the bacteria in your gut. Your level of inflammation influences the bacteria that want to grow there. And then the bacteria that want to grow there learn to live in this slightly more inflammatory state, and they too produce chemicals that keep that state, because different subspecies of the same, I mean, there was a great bug, anyways, prosnitzi. I like, not that there's a million of these bugs and I forget them all the time, but this is an interesting story because this is a bug that's supposed to be kind of vaguely healthy for the gut. But it turns out that there's one species of that like to grow in inflamed guts that actually increases atopic dermatitis. When for most people, if you have the right subspecies of this gut, of this bug, it actually lowers inflammation in your body, and it's really cool. But if you're growing in it in the wrong environment, it changes and it creates chemicals that cause inflammation. So this is the feedback loop, and that's why people get so frustrated, because on some level you can do micromanagement. Sometimes you can pick the right replacement bug, probiotic. Occasionally, I mean, that's the thing, is that I wouldn't count on it, but I have seen cases where people take the right probiotics, and my God, everything starts to shift in the right direction. Unfortunately, I think that's not that common when people are really ill. It's all where you are in that pathway, in that early pathway when you're just fatigued. I see a much better response to the general probiotics and colostrum and just quieting down the inflammation in the gut. The same thing with the with removing the heavy metals. And that was, again, in the 90s, that was my big focus in the beginning. I was a big heavy metal guy. And I would see some amazing things. But as I worked longer, the patients who came to me were sicker and sicker, and my success rate doing the straightforward things was less and less, because their bodies had developed compensations. So if I tried to remove the metal, they got sicker. If I gave them, the probiotic of the month, they blew up and had more discomfort. So it became, so your path, your and I'm very bad at numbers of things, but your 5 or 6, these are the things I agree with 100%. I mean, that's why I love your work, Evan, is because I think the organizational approach to it and making sure people aren't missing these things is critical for a baseline. And so many people will heal if they follow that. And it's just the people who have already been sick long enough that there's that pickup sticks mentality. Now we upset the whole pile with moving something that looks like it's safe, and that's when it comes to, experience, intuition, and more testing, which makes people crazy because none of our tests are that great, but they are sometimes. I tell people, a negative test doesn't mean much, and a positive test means maybe.
Right.
Which is very frustrating because people want, a negative means I don't have it, and a positive test means I've got it. And that's not how it works in this field, because you can have a million positive tests And it just means that there are maybes. They may be bothering you. They may have been an issue. Your immune system just might be upregulated. I mean, you can't go, oh, I have EBV, or I have mycoplasma, or I have Lyme, or I have Bartonella. Yes, but most of the time, even if you have a positive PCR, well, if you have a positive PCR, we should probably do something about it. But short of that, and even then, it might not be right to do something about it now, because it might just make you a whole lot sicker, and often will, until we fix what's underneath. So go back to, I'm sorry, it's time for you to redirect me again.
You're doing great. You're doing great. So let's talk about that. So in the last 6 months or so, I've kind of changed my tune a little bit on this, where I'm doing less and less testing. The more that I see, it used to be that I'm testing people, every 3 months, heavy metals, chemicals, molds, infections, and seeing what's coming out. And as I work with people, I'm seeing everything coming out. So depending on when it is in the cycle, sometimes there's different heavy metals coming out, sometimes there's different chemicals, sometimes different molds and mycotoxins, sometimes different infections. And so what I'm finding is that these people who I see who have chronic fatigue, they really need treatment for all of these things. And in part, it's also because they're all interconnected, and the heavy metals and chemicals are feeding the mycotoxins and the infections. They're all bound up. And as you go after one of these things, the others are being released. And so you need to make sure you've got some heavy metal support on board and some chemical support on board when you're going after mycotoxins and infections. So that's been my thinking lately: less testing, treat all of these causes, because the whole combo is going to be there in different amounts for different people, but they all are there. What do you think about that approach?
Yeah, I love it, because I mean, I test in the beginning, because as a check, because just to have an idea that my ideas kind of are fitting the patient. So I have so low confidence in so many of the testing that I don't have the need to repeat a lot of it. It's one of my great frustrations in this field, is that though I think our testing has dramatically improved over the last 20 years. The tick-borne testing especially, it used to be really, really not good. And now we have enough different ways of looking at it that I feel more confident. But even when I feel more confident that it's there. And now, using some of the T cell testing and the PCR testing, I can have more confident that it's actually playing a role now. When it comes to molds and mycotoxins, um, I've always the history to me is always the most important part there, because I just don't feel that I have enough faith in any of the tests to know 100% that this is really a big player for you. Again, because I've seen too many really abnormal tests in people who aren't having many symptoms. And because it varies, again, exposure, we don't know. But eh, anyways, I digress. But this is my bias. This is not. I want people to understand that in this field, don't take anybody's word for like black and white, because we're all learning.
Right.
My big fault with the laboratory companies is they don't spend enough of their resources on more controls and more testing, to see
Research.
for validity. Okay. It really is upsetting, because they have the resources. I helped start a little lab that years ago, so I know the profit margins that, like when you start and they're not there, but I know what's there, and I just don't think it's right. They should be spending, a little bit more on validating what they're seeing, but they get the test out, we all start buying it, and then they don't want to find out.
Mhm.
And that's not right. It's my personal.
Yeah, no, I agree. I think the challenge also is that, depending on where somebody is in their healing process determines what's coming out of their body, right? So we could do a heavy metal test right now when people are, just come to see us, and nothing might be coming out, but 6 months later, there's a whole bunch of stuff that's now being dumped because of a number of the things that we've done. So I think that's also a really a challenge with trying to do the research, is that, these companies, they may not feel very comfortable about the validity of their test because of this exact thing, where they're like, and how do you actually know what truth is? That always kind of bugs me about it's like percent sensitivity. And it's like, well, what are you comparing it against? How do you know for sure? It's like this test is only this amount good because this over here is telling us that it's perfect. Well, that's a different test, and we still don't know if that test is perfect, right?
Yeah, well, the gold standard in medicine is they often use that as and it's not very common to have real gold. Mo- most most of medicine is still based on strongly held opinion. We call that a grade C. They grade. A is
Evidence-based
double-blind
medicine.
placebo-controlled study, and B, I think, is some perspective. I forget which way it goes. And grade C is expert opinion. And expert opinion, you're getting it today, and take it for what
Right.
it changes. I learn something tomorrow, and my opinion changes because
Right.
you know, we are dealing with when we're dealing in the world of medicine in general, it changes. I mean, that's why, immunology and everything you read online about Th1 and Th2 and now Th17, it's gross simplification. Okay, gross simplification. I mean, and when you
Right.
go into the details, sometimes the information actually gets less because we need to have the simplification because we can't think about about the details. And when that's maybe I shouldn't say it, can be frustrating for a patient to hear that, like, because I get frustrated. I get some lab tests back and I go look for the immunologist who's going to help me figure out what this really means, and I find out that they don't. The clinical immunologist, meaning the immunologist that's a doctor, just tells me, oh, this doesn't mean anything because he hasn't seen the pattern before. And the immunologist who knows what the real test means, doesn't know how it applies to people. He knows what it does in mice. So it's that's not a very, what I'm trying to tell people is that there's a lot we don't know. Luckily, there's a lot of doctors out there who are now struggling to help people who are struggling. Okay. And we are learning. And I said, I've been studying this stuff for this chronic fatigue world for 30 something years now. And I can tell you that there's more and more information. And not only that, there's more and more research. That's the hope. Long COVID, though I think they're wasting tons of money doing a lot of stupid stuff, there's a lot of good research, and not only that, we're getting really smart people interested in this. Okay, because before COVID, to go into chronic fatigue research was kind of semi. You were kind of betting your career that it wasn't going to be stellar. you know, you weren't going to get the Nobel Prize going after chronic fatigue because people didn't care. You know, that's why your doctor didn't believe you, is because he didn't know about it, or he thought it was just, maybe it's real, maybe it's not real. So long COVID has made a big difference because we still have a bunch of doctors who don't think it's quite real. But less and less, and that's the exciting news. And the some of the immunology. I mean, I can't tell you. We're getting really smart doctors, getting and researchers, which is probably, we need both, because when just researchers work alone, they produce nothing useful. And when doctors try to do it, we produce things that generally don't make the grade to convince the scientific world that something is important. I mean, that's what's so frustrating. When we do our little clinical studies, it's hard to, we don't, it's hard to, it doesn't make that academic grade that we need. But when we can put the real researchers together with academic, with clinical doctors, people actually treating patients, then we can sometimes get the papers that will get the world to pay attention. Anyway, another prayer for better research, because, you know, with all the money being spent, people deserve better results than they get. And
Amen. So we've got a couple minutes left. So tell people where they can find you online and in person.
Okay, well, it's gordonmedical.com. Always should have a better name, but that's what stuck because we have a bunch of doctors who work with me for, one of them, Wayne Anderson, has been working with me for since 2001. So yeah, he's stuck
Wow.
around. Um, we've got Dr. Parpia and Nafisa Parpia, who's, uses just, again, we all do things in our own way. We're all working from the same model, but it's interesting. And just in my own world, I'll often start seeing patients, and then I'll often pass them on to Dr. Parpia, because she is much more systematic. I like the big picture and I get excited, but sometimes I don't have the patience to keep people on a process, and which is really important. I spent 12 years as what I call a regular doctor, and that when you're, admitting someone to the hospital and they're dying, and you do X and they survive, it's that rapid, we get very what's the word, fulfillment. Yeah, and
Get the
with chronic
dopamine hit,
illnesses,
yeah.
it takes, you can get some quick responses, but the real healing takes months, and if not years. And I often want to change things too quickly in people's regimens. So I always like other doctors that I have working with me who are calmer and willing to like sit and go, okay, things are okay, just sit a little longer with it, and so anyway, we have quite a team, Dr. Kunkel, and a big news is Dr. Steve Harris, who is extraordinarily Lyme doc. Because I said we've always been big on Lyme, because even though everything is not Lyme disease, Lyme and its, Bartonella and Babesia and a few others are often a big irritant or a big underlying thing that is not letting people heal. So it doesn't mean you need antibiotics the rest of your life. There's lots of ways of dealing with that. But anyway, Dr. Harris, he's now the president, I think, coming in president for ILADS, is joining, where his group is merging with ours. He has Yvonne and Jennifer Sugden are joining us. And we're just really excited because we all have been doing this a long time and have slightly different ways. And to me, that's what's needed, because we're all individuals. And as I said, the people share maybe 25% of what's abnormal in their quote unquote diagnosis, but that other 75% is crucial sometimes that's about them, to allow us to get into that box that they share with everybody else. To begin to treat that, we sometimes have to quiet down their own biochemical individuality that's not happy. And having lots of different viewpoints is really crucial. So, so Steve, Dr. Harris is great, and he works very closely with Yvonne. I'm blocking Sorensen. How can I block on her name? Who together, Steve is works a little like me, lots of ideas, and Yvonne makes sure that she drives the bus and people are happy. So anyway, it's a real exciting time because we're going to have more ideas. So anyway, that's it. GordonMedical.com. You can read a little bit about us, and we're looking forward to just helping people on their way, and especially people who've worked through your program, and if they're hitting places where it's not working, that's because I think what you do is just such a good way to let the body know that it's safe to heal. And if that's not happening, sometimes we have to have that individual under the hood look a little harder, but
Yeah.
anyway, it's a
And then
great team.
thank you. Yeah. And then you also have a free gift for our audience, the healing cycle, a new approach to chronic illness. So we
Oh, okay.
will drop that below. Eric,
And
thank you.
I should, one other thing, I don't know when this airs, but we do have a uh a symposium, we interviewed 40 interesting people, among them the good Dr. Hirsch, on ways of approaching healing. I think it's called Cracking the Chronic Code, and ticks, molds, what is it? Ticks, toxins, and molds, but really it's everything, and we have a lot in it this time about healing, about healing therapies, about things that people can do for themselves at home and things that you can, do online that aren't expensive, that are about setting the stage to allow your own healing. And I think that we didn't get to talk about that today. I know that you include that as part of your work. That's so important, the biochemistry and all the things we can give you, but it's helping you design a program that allows that nervous system to begin to heal. And our basic neurotic tendencies, we all have them. Sometimes we have to adjust some of them for healing to happen. Not everybody gets to stay crazy their whole lives. So, blessings. And
Eric,
thank you so much, Evan.
yeah, thank you so much for coming on today. I really appreciate it.
Okay, my pleasure.
So if you have chronic fatigue, long COVID, or mast cell activation syndrome and you're looking for help, check us out at energymdmethod.com. We have a program for almost every single budget, and we're here to help. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.